Hi, this is Jason Morgan with MuscleWorks Fitness in Carolina Beach, North Carolina. Today we're going to teach you how you can get rid of your C-section belly fat. A few things that you'll need to get rid of your C-section belly fat are as follows: advice from your physician, a good sound nutritional program, a place to exercise. I also recommend consulting with a fitness professional for your exercise program. Let's talk a little bit about what actually occurs during the course of a pregnancy, then going into a C-section. The abdominal wall can be stretched and even damaged during the course of a normal pregnancy. How much damage is done to your abdominal wall during the course of your pregnancy or pregnancies can actually determine whether or not you'll be able to get that last little bit of a pooch, especially in the lower abdomen, which is very common with C-section patients. You may not actually be able to get that off if there's a lot of damage done without some surgical intervention. The pregnancy is going to stretch the abdominal wall depending on your age and the shape you were in before you got pregnant, and what you did during your pregnancy is going to have a lot to do with how quickly that abdominal wall recovers. Now in a C-section, obviously they make an incision and pull the baby through the abdomen instead of going through the normal birth canal. So now you're talking about actually having a surgical damage, surgical created damage to that abdominal wall. If that wall is not stitched down a little bit tighter, you can actually have a pooch that's created, and that may not be able to be removed through exercise. If you feel like you have a little bit of excess fat in that lower abdomen area around the C-section, the first thing you want to do is make sure you're on a good sound nutritional program. You want a complete exercise regimen that includes weight training, moderate cardiovascular exercise, and then following it up with maybe some targeted exercises for the lower abdominal region. Some of the medicine ball exercises are great, and I prefer to use those with my female clients. Some of the exercises that I recommend to help you get rid of the C-section belly fat are the Russian twist, utilizing a medicine ball, the hanging knee raise, and the weighted crunch.
Go ahead.
If you utilize those exercises about 3 times a week, you should see that C-section belly fat start to dissipate. And those are just a few tips and recommendations on how you can get rid of your C-section belly fat.